Hi, my name is Lavinia. I'll be presenting to you on the topic what happens to your body during pregnancy. Next, we're going to talk about the common aches and pains. The reason for this part of the topic is so that you understand if you have any of these problems that I'm going to mention, and you do not get too panicked or get too clueless about what's going on. So if any of these symptoms matches whatever that you're going through, then maybe you should start approaching your doctor or approach a physiotherapist to ask them a few questions. So the common one where I've mentioned about back pain and the cause of it usually is caused by muscle tightness if you have just developed the back pain during pregnancy. So this one here I'm going to show you is about pubic symphysis dysfunction. So pubic symphysis dysfunction is basically this area here. It's usually this area here where your pubic bone is, and this joinings here gets too flexible and causes friction, which then causes inflammation. You will get pain in this area, or you are known to have this problem is when you start feeling pain in this area as you go out of the car or as you climb the stairs. Anything that involves one-sided movement of the leg. Then the same mechanism goes to in the ribs. So some people will get rib pain, where it's the same where this joining here gets too flexible and then it causes inflammation from too much friction. The last one here you see is a very common problem where, remember the posture picture? So as your lower back arch gets too exaggerated, sometimes you can cause pinching of this nerve, and this nerve is known as the sciatic nerve. So this is a big main nerve that goes down from your lower back all the way to the calf muscles. So if you have this problem, you usually feel a shooting pain down all the way to your legs. Okay, this is a very important point which I really hope that every mother out there will know what this is. So this is called a diastasis recti. So as you can see here in this picture, this is how it looks like for your abs in the pre-pregnancy state. And this is what a diastasis recti looks like. Okay, this happens when your abdominal muscles gets overstretched throughout the pregnancy period, and it doesn't go back after your delivery. This usually happens if your muscles are really weak. Okay, so it can start developing during pregnancy, and it can be reduced by doing exercises during pregnancy. Why? It's because you can just imagine this. If you have a piece of rubber band, okay, so you stretch the rubber band for about 9 months. When you let it go, will it go back? No. So, but if you stretch it and then every now and then you let it go, you pull it again, you let it go, and you pull it again. When you release it after 9 months, will it at least go back slightly? Yes. So it will have that tensile strength, or we call it the retractability. Okay. So same goes for muscles. If you are doing exercises during pregnancy, or if you are already active in some sort of exercises before you got pregnant, your muscle has that activation and has that memory to continue working. So as it gets stretched and you're still constantly reminding it to work, so after your delivery, your muscles will know that, okay, I should now go back to my normal state as much as possible. Okay? After your delivery, you should get your doctor or your maternity nurse or go to a physiotherapist to get it diagnosed, to check your abs to see if there is a major separation. Usually we consider this to be a problem when you have about 2-3 finger gap, or I have also seen a 4-finger gap. So it's this big at the center here. Alright, so will it return to 100%? No, it does not return to 100%. Every mother who has given birth before, even if you have done everything, you're very fit and healthy, you will always at least still have about 1 finger gap, okay, or slightly lesser. You will not go back to how it was before pregnancy. So what happens if you let it be, you don't get it diagnosed, you don't get it fixed? So there's a whole list of problems that may occur where one will lead to another.